Hello and welcome. My name is Daniel Larson, and it's my pleasure to welcome you to today's program featuring Connie Horgan, Professor and Founding Director of the Institute for Behavioral Health at the Heller School for Social Policy and Management, Meredith Berkman, co-founder of Parents Against Vaping e-cigarettes, also known as PAVe, and Alexandra F. Kritikos, a vaping researcher and doctoral candidate, PhD 20, at the Heller School for Social Policy and Management. Professor Horgan will serve as moderator for today's discussion on the topic of vaping in America. We are delighted to welcome you, our alumni, parents, Brandeis National Committee members, and friends from around the world. Thank you so much for joining us. Now, to introduce our speakers. Professor Horgan is a national expert on the organization, financing, and quality of behavioral health care. Her research is focused on how alcohol, drug, and mental health services are financed, organized, and delivered in the public and private sectors, and what approaches can be used to improve the quality and effectiveness of the delivery system. Meredith Berkman is co-founder of Parents Against Vaping e-cigarettes, a national grassroots advocacy group formed by 3 New York moms as a response to the youth vaping epidemic. A former journalist, she wrote for magazines including New York and Entertainment Weekly, and was a columnist for newspapers including the New York Post. Berkman is a graduate of Brown University and the Columbia Graduate School of Journalism. And finally, Alexandra F. Kritikos, MA, is a PhD candidate studying health and behavioral health policy at the Heller School for Social Policy and Management. She is a National Institute of Alcohol Abuse and Alcoholism pre-doctoral fellow. Her recent research includes work on cannabis regulatory policy, commercialization, youth prevention, and polysubstance use. Kritikos received her MA in Applied Economics from Northeastern University and her BS in Economics from the University of Patras in Greece. And now on to you, Connie. Thank you.
Okay, thank you, and welcome to everyone to our very exciting dialogue today about vaping among the U.S. youth. It is such an emerging crisis. We think of vaping maybe back in the start of this the century, that it was promoted as a healthy alternative to smoking. And here we are with vaping perceived as a problem. It is a cultural phenomenon. You'll be hearing some phenomenally astounding statistics today about the fast pace of vaping in this country. But we're not just giving you statistics. We are going to be talking about what are the solutions to this emerging problem. This is so key to be thinking more broadly and putting this in a broad public health perspective. To do that, we're sticking with our Heller byline, which is knowledge advancing social justice. And to do that, we believe that there has to be the research, but there also has to be the policy and the advocacy to go along with it. So we're structuring our presentation today to have 2 perspectives brought together. We will be starting out with Alexandra Kritikos, who is our stellar doctoral student at Heller, who's been focusing her research on vaping, who will give you an overview of some of the research, particularly focused on adolescence. And then we will be moving on to Meredith Berkman, who will be the activist here, bringing a different perspective, a much needed perspective, because our argument is it's together with the research and the activists that we need to move forward in the policy world. Before we begin, I would just like to give you a game plan on the structure of today. We will start out with our 2 speakers. First, the researcher. Second, Alexandra. Second, Meredith, the perspective of the activist. Each has a set period of time, and we are not taking questions at that point. Then we will be moving into getting these 2 to talk. We're talking about research and the real world of activism. Let's have an exchange and a dialogue between the 2 of them. I will be moderating that discussion. And then the second half of our hour today will be spent with you, the audience, asking questions. And there's ample time for questions in this period, and hopefully you will be part of helping us think through solutions to this problem. So welcome to all who are now, I hope, on the line, to alumni, parents, and friends of the Brandeis National Women's Committee. Thank you for being here. I know we have a rather large audience, and I am so pleased that you're here. I'm so pleased to actually have gotten some messages from former students who joined in. So this is a real treat for us. And with that, I would just like to move right on to Alexandra to share with us the researcher perspective.
Great, thank you so much. I will start sharing my screen at this moment. So just an okay that you can see my screen, my slides? Yes. Okay, thank you so much, Connie and Daniel, for that great introduction. I'm so happy to be here. Thank you so much for having me. I am going to deep dive right into our topic for today. What is happening with vaping and adolescence? Considerable progress has been made in reducing cigarette smoking among our nation's youth. However, the tobacco product landscape continues to evolve today, and public health and medicine are currently facing a new challenge: e-cigarettes and vaporizers that were first developed in the early 2000s and have become an emerging phenomenon. So what are these new products? They are battery-operated nicotine delivery devices that resemble traditional tobacco cigarettes. And even though in the beginning they were just used to vaporize nicotine, today they are also used to vaporize flavoring, marijuana, as well as other substances. So what are we concerned about? Well, first of all, many who are vaping just believe that they are inhaling and exhaling air, just water that evaporates. But we do know that these devices contain ingredients that are known to be toxic to the human body. Second of all, when we look at either nicotine or marijuana vaping, and we look at the nicotine and or marijuana levels in these devices, we do see that these levels approach those of traditional cigarettes and could even exceed a typical marijuana joint 4 to 30 times. And we're going to talk about why that is problematic. Third of all, and this is the focus of today's presentation, nearly 1 in 4 students report vaporizer use in the US today. And then finally, from the research perspective, as a researcher, we really are going through a social experiment. And what does that mean? That since these products are very, very new in the market, we don't have enough data to really talk about what are the health effects quite yet. So why do we focus on adolescence as a focal point? Well, first of all, substance use, nicotine use, marijuana use, alcohol use, whatever that is, typically begins in the middle to late adolescence and peaks in the early and middle 20s. Second of all, adolescents are more susceptible to environmental influences. So that means that if your friend is trying something out, if there's a new trend in school happening, if you are at a party and your friends are engaging in some type of a behavior, then you might also be more susceptible as a young adult to engage in that behavior as well. And then finally, the most crucial piece is that adolescents' brains have not fully matured. So what does substance use have to do with a developing brain? Well, adolescents and teens are especially susceptible to the adverse effects of nicotine and marijuana use, since their brains are still undergoing neurobiological maturation, which means that if a student is using a vape to consume nicotine and or marijuana, they could develop a nicotine dependence. It could be likely that they develop a cannabis use disorder. It could affect their IQ levels. It could impair judgment, which might lead to other risky behaviors such as driving under the influence. And then finally, a big part of my research is also looking into co-use. So are students who are vaping also engaging in other substance use behaviors as well? And at this point, I'm just going to take a very, very brief second because I know that Meredith is going to talk a lot about this. We know that these products entered the US market in 2007. And up until 2016, now that's almost a 10-year, almost 10 years after that, there were no regulations. So these products could be bought anywhere. You could find them all around the mall, in your convenience store down the street. There was no age restriction, and they were also freely advertised. So we can understand what implications that has on youth substance use. So deep diving into the data, I'll start right here. This is just an overview of what has happened in the US. These products entered the US tobacco market in 2007, and sales have been exponential. Just looking at 1 year, 2012 to 2013, there was a 150% increase in sales just within that year. If we look at those numbers today in 2020, they are much, much, much higher. Also very important, there are over 500 brands available in thousands of flavor variations, ranging from juvenile flavors such as bubblegum and cotton candy to very sophisticated flavors for adults. And then finally, if we look at who really started consuming these products, we see that the largest increase in consumption has happened specifically among youth. And this is what I will be talking about in the upcoming slides. So right here on the right-hand side in this graph, we are looking at annual youth consumption rates across the US. And this is data from the Monitoring the Future survey, which is a nationally representative survey of US youth. And what we see is that from 2015, where the survey started tracking vaping questions up until 2019, which are the most recent results, we see this increase in use among youth. And it is quite a large percentage. If we see that in 2019, it's about 30% for just this annual consumption. But what I would like you to focus on is on the two bars, 2017 and 2018, and that very large jump that we see there. So that jump from 2017 to 2018 translates into 1.3 million additional adolescents that vaped just in that year. And if we look at the history of the Monitoring the Future survey in the US, that is the largest increase in a substance use question that has ever been asked on that survey. So that is very worrisome for many reasons. So these were annual consumption rates. But here I would also like to show you past month, specifically nicotine consumption rates, because it's very important to look at past month to understand prevention from a better perspective. So what we see here happening on the right-hand side is a couple of things. First of all, again, we see that jump from 2017 to 2019. We see that increase in past month nicotine consumption. But what we also see is that 12th graders who are in the dark bars are consuming more compared to the 10th graders who are consuming more compared to the 8th graders. And that is something that we would expect. Now, if we translate those numbers, that 25% that we see in past month nicotine vaping among the 12th graders, that translates into 1 in 4 12th graders has said yes to past month nicotine vaping. 1 in 5 10th graders and 1 in 10 8th graders. And I would like you to all think about that. If this is past month, just past month vaping, then what would the ratios be if we asked about, have you ever used nicotine in a vape in your life? Those numbers we can understand are much, much higher. One more point that I would like to focus on is going back to what I mentioned in the first slide, which is that these devices today are used to vape many different things: nicotine, marijuana, flavoring, and a big focus today in the research is that youth are using more nicotine in these vaping devices, but they are also using more marijuana. And this is what these graphs show. The gray is 2017, the year 2017, the light gray, and the dark gray is the year 2018. So we see this continuous increase among 8th, 10th, and 12th graders for vaping nicotine, but we also see an increase in vaping marijuana. And again, the 12th graders are using more than the 10th graders and more than the 8th graders. And then finally, the last graph with data I will show is something that, again, I've been talking about again and again, which is that it's important to not just ask, oh, are youth vaping, but what are they vaping? Because we see that, you know, almost 30% have said yes to vaping nicotine, 26% have said yes to vaping flavoring, 13% have said yes to vaping marijuana, and then there's also a percentage who don't even know what they have vaped. And that is problematic because you wouldn't want anyone not knowing what they are putting in their body. Correct? So finally, I would like to just finish with two broad questions, just some food for thought. The first question is, are vaporizers the new gateway drug? Even though we really don't talk about the gateway effect anymore, I would just like to pose, you know, if students do perceive these devices as less harmful, if they are appealing because of the various shapes, sizes, fun flavors, and colors that they come in, we know that youth are more likely to experiment with their friends at parties. And at the end of the day, these devices do contain nicotine and or other substances. So someone who might just be starting off because they think something is fun or cool could get hooked on a substance. And the final question is, I won't deep dive into this, but what is the policy concern? And I know that we're gonna have a great discussion with Meredith, so I'll just end here. Thank you so much.
Thank you very much, Alexandra. That's wonderful background. And now let's move right on to Meredith Berkman. Can you move us more into the policy work that's going on and tell us about what you have been doing? So
sure.
Thank you.
Thank you.
The
Thank you so
activist
much.
perspective.
So funny, I think of myself as an advocate or a momvocate, a mom who advocates. We call ourselves momvocates because it seems less threatening sometimes. But I suppose you're right, it is activism. I think that we have a couple of polling questions that we were going to ask. If Daniel can put them on the screen, because I don't see them. I'm not sure if others do. And the first one, and I'll, just to give a perspective, so how many e-cigarette flavors remain on the market after what has been called the federal flavor ban of 2020, which we'll get into in a bit. So the choices are 200, 34, 15,000, or 5,000. And the reason that we're asking that question is because for our advocacy, we're completely focused on the flavors of e-cigarettes. Maybe we'll go to the next question, and then I'll go to my slides where I'll launch into how I ended up here. I think the next question, just the answer, and there you have it. How many flavors remain on the market after this year's, quote, flavor ban is actually 15,000. There were 15,000 flavors of e-cigarettes on the market before this flavor ban, and there are 15,000 still on the market. So I think that gives you a sense of some of the activist frustration with regulation. And the next question, let's see if we get the next question. How many states have banned the sale of all flavored e-cigarettes? And the choices are 2, none, 12, or 4. And again, I think that gives you a bit of a guide to what we'll be talking about. So we're talking about how many states have banned the sale of all flavored e-cigarettes, because that is at the key advocacy point for us, because we're focused on kids, because we're parents against vaping e-cigarettes. We're not looking to ban devices or tobacco flavor, but we're looking to get rid of the flavors, because the research has shown that it's the flavors that have hooked the kids. So we can Wait for that answer. And the answer is actually 4, and one of them is Massachusetts. In fact, there are 4 states that have banned the sale of all flavored e-cigarettes, and that right now is New York, where I live, Rhode Island, and New Jersey, and the 4th is Massachusetts. But Massachusetts is in a really wonderful position. That is the only state in the country that has so far banned the sale of all flavored tobacco products that hook young people, not just flavored e-cigarettes. We're very grateful for that. And I think there may have been one more question, which I only threw in there because I knew you would have the answer from listening to Alexandra's remarkable presentation, but it bears repeating. How many high school students report that they're vaping on a regular basis? 1 out of 2, 1 out of 4, 1 out of 5, or 1 out of 7? So if you were listening to Alexandra, which you should have been, which I was, because I learned a lot and I appreciated her presentation very much, you hopefully will know the answer. And the reason that I'm repeating it also, let's see if we get the answer. There it is. And everyone was listening. What a great audience, 1 out of 4. And the reason that again, that I wanted to repeat that is if we had, I always joke, if we had $1, you can take that down, thank you. If we had $1 for every parent that thanked us for our work and said, oh, it must be so awful. I'm just so glad that I have a great relationship with my kid and my kid doesn't do it. We would be running the world. And so we use that statistic, 1 in 4 high school students, when we go into schools around the country now doing it digitally. And you can see people thinking, well, I'm glad it's not me. So I literally point to parents and I say, okay, just to give you the perspective, 1, 2, 3, your kid, 1, 2, 3, your kid, because we want people to understand with 1 out of 4 high school students doing this, it has been referred to by the former head of the FDA, by the Surgeon General, as the youth vaping epidemic. And that's really what it is. So I'm going to ask Daniel if you want to just quickly show the slides. And mine is not a formal presentation. And that's not by design. That's by design of the role of the parent activist, I suppose. So our group is called Parents Against Vaping, E-Cigarettes, or PAVe, and our website is parentsagainstVaping.org. And you can go to the next slide, Daniel. But what we do is, this is our mission statement, which I'll let you read quickly. We're a national grassroots organization founded by me and 2 friends as a response to the youth vaping epidemic, which this was written pre-COVID, but at that moment it was and likely remains the most serious adolescent public health crisis that our country has faced in decades. And this is the part I want to get to as an introduction. The catalyst was our discovery about a Juul representative coming into our children's school and telling kids that Juul, while not for them, for adults, was, quote, totally safe. So I think we can go to the next slide. That will give you a sense of what catapulted us to do what we do. This slide represents the moment when, and I'll just give quickly the backstory. In April of 2018, my son, I have 3 daughters and 1 son, and my then 16-year-old son came home from school and said, I have to tell you about this anti-addiction talk. It was really strange. The teachers left the room, which is something that the teachers normally do in these situations. And the adult educator from an outside group began to talk to us about Juul. And as my son said, and as you read there, while telling kids that this was not a substance that they should be using. And at that point in 2018, this was really below the radar for certainly most parents that we've come across, myself included. But there were lots of kids who were doing it, and including my own son. And my son said, they kept saying it's totally safe. And they told us that it would receive FDA approval any day. And both of those statements to this day remain untrue. Within 24 hours, I had called 2 friends, my co-founders, Dorian Furman and Dina Alessi, and a little bit of digging, because I was a journalist, we discovered that the school had no idea that the outside anti-addiction group, which interestingly came from Massachusetts, naively was led to, through a Google Analytics, to the Juul website, where Juul had a named youth prevention education employee at that time who was all too happy when asked for an anti-Juul speaker to send a Juul rep into the school. You can go to the next slide. That moment when we made that discovery, my friends and I decided that we would have to essentially join whatever was out there, like a Mothers Against Drunk Driving, a vaping. And that's because late at night over the next weeks, we began researching this issue. What was Juul? What was vaping? How big of a problem? And my co-founder, Dorian Furman, speaks quite a lot about having found a Juul which resembles by design. It looked like a computer charger, right? And kids were using these things in hiding them, hiding in plain sight, stealth by design. When we realized that this was an enormous problem and that these products had been marketed by Juul on social media channels where parents were not going, we realized we had to get involved. And there was no group out there where parents could get information or could take action. And so I like to joke that we're the necessary idiots that had to start the group we would have preferred to join. And things happened very, very quickly for us. We started with a website, which we launched in the fall of 2018, which we intended to provide lots of information for parents like us. But very, very quickly, we realized that we would have to advocate. And that's what the slide here, we can go to the next one. We began advocating. We started in our own state, in our own city, because we realized as we reached out to researchers and we reached out to public health groups that we didn't even know existed on this point, we understood that we had to put a human face, a personal face on this issue. The reason that I'm backtracking and showing you some of these slides is just to give you a sense, if you look, and this all came out in our congressional testimony, and just to also back up for one moment, this event happened in 2018. We did not share it publicly because the school had no idea. And we didn't want to make it about one school. As we did our own deep dive into the work of researchers like Alexandra and many others, when we saw what was really just coming out there, because of course there's a gap between what's happening in real time on the ground and research, and appropriately so. This is science and peer-reviewed journals, so it takes some time for things to come to the public's awareness. And one of the problems was social media, and Juul was the, and this is not, this is something that has been said very, very widely. We used to call Juul Big Tobacco 2.0, but then Juul received billions of dollars in funding from Altria, the big tobacco company, and then it was very clear that this was big tobacco. You can see from this youth marketing slide the Juul, and you can just see the use of young influencers. The one with the ponytail seems to resemble Kim Kardashian. You can go to the next slide. The use of influencers and events. You see some of the other products like Blue, but when Juul came on the market and really made a splash, let's say in, I guess it was introduced in late 2015, early 2016, it was a complete game changer for the e-cigarette industry. You can go to the next slide, because essentially this was a product, and you can see again the use of social media, the use of youth. This was the way in which youth were being targeted. And again, Juul itself has admitted to the use of young influencers, the use of what we were a party to was at that point, they were using what they called a curriculum, and they would use that to go into schools and to teach prevention, but certainly in our case, to repeatedly tell kids, which my son Caleb and my co-founder Dorian's son testified about, was sending a really dangerous mixed message. I mean, these were kids who were hearing that this was not for them. And yet at the end of the presentation, when my son Caleb went up to the educator with Dorian's son and another, and our third co-founder's son Luke, to ask more questions, the Juul representative took out his own Juul, showed the boys how it worked and called it the iPhone of vapes. And I guess that's where the activism piece comes in. When it hits your child, when it hits your own family, I think, for lack of a research technical term, I think we went into full mama bear mode. And we, you can go to the next slide, but this is just to give you a sense. The problem is so complex, and I have such great respect for the work of researchers like Alexandra and the work of people in social health, public health research like Connie and Heller Institute. What we learned very quickly was we were going to have to advocate. As Alexandra said, there were no regulations on these products. And I want to repeat that. We're talking about tobacco products that were allowed to proliferate in an unconscionable way without the federal government's full regulation. And in fact, that could be a webinar in itself, because the date by which products had to remove themselves on the market and then go back for full FDA regulation, it's called the pre-market review process. That date was pushed back and pushed back. It was agitated many times until finally, after public health groups like the Campaign for Tobacco-Free Kids, one of our great partners, the American Academy of Pediatrics, was actually, it was a case, I believe it was in federal court in Massachusetts. Ultimately, the date was pushed until 2021, and then finally to 2020. And all of the products, all of these disposables, the thousands of products that Alexandra mentioned, including Juul, were going to have to be removed from the market by this past May to go through the regulation process. Because of COVID, it's been pushed back again until September. But the problem for us as parents who are advocating to protect our kids from two things. First, the dangers of the youth vaping epidemic, the dangers of these tobacco products, and the dangers of the predatory behavior of big tobacco. Why has our government allowed these products to remain on the market? Why have they allowed this to happen? So much of this was avoidable. So we became advocates. We have since also created an education initiative. So we are both advocating and educating. And so our goal is to advocate for a ban on all flavored e-cigarettes, again, because research has proven that the flavors have hooked our kids. And when we're working in coalition with our public health partners in cities and states around the country, we're in about 16 states now. We started here in New York and we fanned out. We are in coalition with groups that include the Campaign for Tobacco-Free Kids, the Heart, Lung, and Cancer Societies. One of our great partners also is the Truth Initiative. We work with, again, the American Academy of Pediatrics and local groups. We work in coalition for a ban on all flavored tobacco products, including all flavored e-cigarettes, but also all menthol cigarettes. And that makes things even more complicated. And I can go into detail later about that. And that's, again, the menthol cigarette piece, which is a real social justice piece, relates to the predatory behavior of big tobacco the first time around, and the use of cigarettes. All flavored cigarettes were removed from the market in 2009, I believe, and yet menthol cigarettes remained on the market. And if anyone has interest, I can recommend a short film on YouTube called Black Lives, Black Lungs that very, very powerfully talks about the preying upon communities of color by big tobacco and menthol cigarettes. When in some cases, when it's not possible, as it was in Massachusetts, the gold standard of removing all flavored products from the market, we will accept, with our partners who will, just a ban on flavored e-cigarettes. We came to the table for the flavored e-cigarettes, but we remain to fight in coalition to protect kids in all communities from flavored products. So I just want to go to the next slide. We mentioned here disposables. That is related and is a huge problem for us at this moment. The 2020 federal flavor ban, which we went from sitting around my kitchen table, a group of moms, sort of figuring out how we could fight these products and protect our kids. There are 5.3 million kids, according to the National Youth Tobacco Survey of 2019. Alexandra mentioned Monitoring the Future. This is the other national survey. And this is wildly outdated at this point because the 2019 survey is looking back at what happened over a year ago. So by the time we get the next data, which will be delayed possibly because of COVID, you know, this is growing in leaps and bounds. I mean, there was a 178% increase over a 2-year period in kids' use of these products. The federal flavor ban inexplicably left out disposable products. These disposable products, the most popular of which is Puff Bar. And you can see they look, again, they're stealth by design. There's something called Swarin, which looks, it's sort of pink and yellow. It looks like a highlighter. All of these candied flavored products that are disposable are out there. Any product that can be refilled with a juice that relates to the 15,000 products, all of these are out there. So we went from our kitchen table to sitting around the White House conference room table, which was in one of the photos of my wearing a pink dress. Pink seems to be, it's a symbolic color meant to represent the power of moms. And I know there's something cheesy and throwback to that, but I think the authenticity of our voices, because every single parent who advocates with us across the country is a volunteer. We are building and we continue to build a serious national grassroots organization, but none of us are paying ourselves. What we're doing is fighting for our kids, and what we realize quickly in terms of advocacy and education is that parents listen to other parents. We're not judging anyone because this happened to us. And the level of nicotine addiction, again, that Alexandra talked about, the nicotine addiction from these products, because there is so much more nicotine in these e-cigarettes than in combustible cigarettes, because there have been no regulations. I think one of the really important facts you saw was about Juul, which said that there is as much nicotine in one Juul pod as in an entire pack of cigarettes, possibly up to 1.5 packs of cigarettes. And there's even more in these disposable products. So the flavors are hooking the kids, many of whom don't know there's nicotine. And you know, Alexandra talked about the brain issues where there is emerging evidence about cardiovascular issues. And of course, the danger and the damage to our kids' precious developing lungs. I don't want to go past my time. You can go to I think it's the final slide. But in addition to advocating at the federal level, we've testified multiple times before Congress. We have had multiple private listening sessions at FDA where we've made our concerns known. We've just started a letter writing campaign of parents across the country complaining about the wildly egregious, particularly during the pandemic, predatory behavior towards teens of Puff Bar and all of these disposable products. We have launched during this COVID time of digital pivot, we launched a podcast called Big Tobacco Messed with the Wrong Moms, where we interview moms whose children, for example, have suffered EVALI, lung injury. We've also interviewed, Illinois Representative Raja Krishnamurthy, who's before whom we've testified. We interviewed Dr. Nora Volkoff, the head of the National Institute of Health, NIDA, National Institute of Drug Addiction. That is, we've had up to 30,000 people listening, people who are parents and others who care about this. You could go to the last slide. And then finally, education. We've just launched in the last few weeks a volunteer educator toolkit that's both in English and Spanish. We do webinars both nationally and regionally, but our goal through this program, and I think there's one more slide, is to empower parents like us all across the country to go into their own communities with this information and share it with their schools, with other parents. You could go to the final slide, and this is how you can reach us. I guess so to wrap up, we're parents who came to the table because Juul came into our school and marketed to our kids, and there was no way to elevate our voice. So we reached out with all of the experts, and our goal is to give a human face to the problem and to amplify the really, really important heavy lifting that people in the public health community, both as researchers and as policy people, have done for decades. My final point is that you have to remember, we're talking about an entire generation of kids potentially, 5.3 million. We won't know for some time how large that number is today. These are kids who would otherwise not have been initiated into the use of tobacco products. And how do we know that? Because all the heavy lifting that was done to make smoking not cool among kids, the youth smoking rate was at its lowest number ever, below 7% before Juul came on the market. And we will not allow big tobacco to take another generation of kids and turn them into lifelong customers. Thank you so much.
Thank you, Meredith. I think that you have really proven that mama bears make great advocates. So
do daddy bears too. Thank you. I don't want to be, just to be fair. Thank you.
Thank you. Let's move on to having a discussion between the researcher and the parent activist, the parent advocate. I'd like to start out with a question and then just turn it over to you for 10 minutes or so and just exchange your perspectives on finding solutions. But I'd like to start out actually with where Alexandra did a great job showing about the prevalence of vaping, particularly among adolescents. We certainly have stuck in our mind the popular press that vaping is positive aspects. It's a tool in quitting. It's better than using cigarettes.
But there's no research. There's no research that proves that.
Okay.
Sorry.
Well, okay. And really, what and Alexandra said we're in the middle of an experiment, really, and traditionally health effects have a lag time in showing. So, can you tell us, is vaping really bad for you, since there are some positive aspects, or are there? What's the evidence? And Alexandra, do you want to start, and then Meredith, and then move on to whatever you want to talk about, because I'm dying to hear you.
Yes, great. So as an economist now, I'm thinking about, okay, point 1A, point 1B, but I'll keep it simple. So yes, these e-cigarettes and vapes, they basically heat nicotine flavoring to create an aerosol. And like I mentioned, many believe that that is just water that evaporates, but there are actually harmful toxins that do harm individuals. Are they less harmful than combustible cigarettes? In many ways they are. So you touched on a really important point, Connie. You talked about adults and kids. So if we're talking about adults and they're trying to switch from cigarettes to using an e-cigarette, that's one story. But like Meredith also mentioned, if there are kids that are picking up these devices, and we know that, first of all, they contain toxins that are harmful to the human body, that's very dangerous. We've also seen in 2019, 2020, this huge lung injury outbreak and deaths associated with vaping. And that has a lot to do with a piece that Meredith was talking about, the flavorings and the juices that came from the black market. And kids can take these juices and refill them on their own, or they could buy these products online. They're not from a credible source. And then finally, I also talk a lot about the marijuana vaping, and a lot of the lung injury from there, because when individuals are vaping marijuana, and specifically the THC, that is the psychoactive component of marijuana in these devices, that also has harmful complications for humans. And then these devices are addictive. They do contain nicotine. They could also contain marijuana. And Meredith closed with a really important point. There were kids that would have never picked up a tobacco product before, because the US had done such a great job with lowering the tobacco rates. If they would have never picked up these devices before, then if they do, it is harmful for them because they could become addicted to it.
So if I may, I want to just answer first of all, and Alexandra, I certainly defer to you as a researcher, as a scientist, but I do have to take issue with one thing you just said. There is no evidence that, first of all, none of these products are healthy, right? None of these products are good. Is it healthier? There was one study that the pro-vaping community, which is very outspoken, very well organized, very well funded, and I won't say the community, but I will say that many individuals go after us, particularly on social media. This is not a brag, but I've even received a named death threat on Twitter, and that's not fun and scary. But I will say that the one study that the pro-vaping community has repeatedly pointed to as evidence that that e-cigarettes are so much safer and healthier comes out of England, out of the Royal College of Surgeons and Physicians. And I want to just make the point that in fact it's sort of like apples and oranges, because the EU, they're doing a much better job. The rest of the world, not only the EU, they're doing a much better job of limiting the amount of nicotine in these devices. Here, we have done nothing like that. And that's one of the problems. So that these products have been so wildly addictive that survey, that study is really not relevant to whether or not these are healthier, whether or not these are quitting devices. And there was one other study that the researchers themselves recently, and I can cite it for you. I can send that in an email because it just went out of my head. But there is one other study where the researchers themselves came out and said, this study should not be seen as evidence. More information has come out about the harms, and that's no longer what we believe. So number one, while there is certainly less tar, and there's so much research about lung cancer and tar and cigarettes, there has so far only been one study that has shown that when nicotine is injected into at the cellular level into mice, it does cause cancer. Of course, that's the biggest fear, and that's done by a researcher at NYU. And I'm sure that we will be seeing lots more like that, but we can't predict the future. When you referred to this as a social experiment, and just to put it in our context, and I said this, in Congress, that our children are being used as lab rats. They're being used as, as test tubes for the e-cigarette social experiment. And we don't advocate for adults, in the sense that we don't, it is not our job to tell adults what they can and cannot do. And I think that in addition to the vaping industry, there's the libertarian argument about encroaching on small businesses and the vape shops and the businesses that they would lose. And that's what brought us all to the table with the president and the health secretary. And by the way, in that meeting, I bring it up, it was last November, someone made the point from the industry, these products are safer, Mr. President, they're safer. And of course, the public health groups, including ours, were saying there's no evidence. And the president turned to Health Secretary Azar and said, so is that true? And he said, Mr. President, there is not any conclusive evidence that these products are safer. So I just want to bring that up. And that also relates to the toxin issue. We mentioned the toxins, but just so people understand, we have that in our education slides and I didn't share it. We're talking about propylene glycol, which is something that you might ingest if you eat. We're talking about, things that are used in antifreeze. We're talking about a host of toxins that when they're heated at a very, very high heat, often create a third chemical, a third toxin, then we don't even know what that is. So we're talking about a highly heated toxic cocktail. And because the flavors are private, we don't know what is in the flavors because they're not required to tell us. We don't even know what horrible toxins our kids are sucking into their lungs. And the final thing that you may have mentioned, and I failed to have earlier, I want to also explain what nicotine salt technology is. Juul was a game changer for several reasons. The first was the patented nicotine salt technology, which is now used by really the entire industry as a standard. What that was able to do was to make that first hit of the nicotine much less harsh and so much more potent, particularly for developing brains of adolescents. It's like a more, and I'll let Alexandra, who is the researcher, explain it, because I'm giving the sort of secular version. But one of the reasons that these products are so highly addictive and a game changer is because Juul patented this nicotine salt technology, the use of flavors, which Dr. Volkov, the head of NIDA, again, the flavors create a pleasant association. And we're talking about flavors like blueberry raz, grape soda, things like unicorn snot, these flavors that, while adults may very well enjoy them and want them, there's absolutely no evidence they need them to quit through the use of e-cigarettes. And remember, there's also no evidence that people who are using e-cigarettes are actually quitting. In fact, some of the research has shown there's dual usage, and that's for adults. So it's the nicotine salts, it's the use of enormous amounts of nicotine that are so much more potent. It's so highly addictive. And of course, stealth by design. Kids were, and many I'm sure continue to, though Juul is no longer as popular as it was, because thanks to pressure from public health groups, including our own, Juul has taken a huge hit. They've been revealed for what they were doing, and they self-corrected by removing some of their most popular kid flavors like mango, knowing full well, I would assert, or I suspect, that they knew the kids would migrate to mint, which the numbers showed they did when mango wasn't available. And then they're allowed to keep menthol on the market. And again, menthol is just mint. So I'm going to let Alexandra jump in. Pardon me, but I do get very worked up.
I'm wondering if I could jump in, and thank you both for giving us the definitive answer. Yes, it is bad. What a crazy question. I would sum that up as. But I know we have a lot of people who have questions. So I'm wondering if we could just agree with a yes, and there's lots more evidence that could be given. But I'd like to turn it over to Daniel Larson, who will moderate the questions that have come in, curate the questions, because I think we have far more than we can answer in the time that remains. So Daniel.
Sure thing, thank you. So we've had lots of questions come in, and we won't have time to get to all of them. But the first one here is, in the time of COVID-19, can you speak a bit more about the detrimental effects and what makes someone maybe more susceptible to COVID-19 against the backdrop of these e-cigarettes?
Alexandra, do you want me to answer that, or do you want?
I guess what I would say firsthand is that when we're thinking about youth consumption specifically, what's also really scary is that we know that, usually if you find a kid vaping, they're probably not going to be doing it on their own. They might be doing it with their friend. They might be using the same device among many. Mm-hmm. So what first comes to my mind is that during this pandemic, where we shouldn't even be coming close to anyone, let alone sharing a vaping device, we can think about how that could really exacerbate the health effects and the health consequences. And I'll hand it over to you, Meredith.
Well, this is the problem, right? There's very little, there's no long-term research yet about vaping. There's certainly no long-term research about COVID. It's common sense that putting anything into your lungs other than fresh air is a huge mistake and risk in light of the COVID, the respiratory pandemic, for anyone, particularly for kids. And we do know, certainly we've referenced the EVALI, the lung injuries, some of them quite catastrophic, that kids and some adults suffered. But yes, as you said, there is evidence, that smoking and vaping, that is clearly problematic. And at the very beginning of the pandemic, FDA did also mention vaping in that category, and then we're sort of forced to walk it back. So while there's no conclusive evidence about any of this, as you said, we do know that kids use these devices socially. And so our fear is that as things open up, I see it on the street, you know, here in New York, I see young people passing them back and forth, and that does put them at risk. In terms of the severity of symptoms, again, these are kids who've been compromising their lungs, whether they know they've been doing so or they have suffered a lung injury. And that's one of the reasons we're even surveying all the people that reached out to us over the last couple of years whose kids were vaping, and SurveyMonkey to say, are there any cases of severe COVID? So we can then go back to the CDC and say, is this something that you should be researching because it's so new?
And actually, just one more point that came to mind is a few days ago, I was reading a blog post in a journal, and it said that I believe that a lot of the individuals that were diagnosed with COVID did have some type of a predisposition to vaping or having some type of lung, not injury, but bronchitis or something of that sort.
Can you share that with me after this? Because I'd love to see that.
Yes, yes. So like Meredith said, the evidence is still so new, but this is what we are hearing first off the bat. So, yes.
I have a question here about the link between vaping and marijuana decriminalization and legalization. The question is, does the successful political push for legalization and decriminalization of recreational marijuana in the States undercut the efforts of public health advocates to reduce the vaping rates of adolescents in the United States?
So I'm just going to say straight out that there are groups that, one of them that Alexandra probably know, called SAM. There are groups that focus solely on this issue. As a mom of 4 quarantines, as I like to say, believe me, this is something I think a lot about. And we don't advocate about marijuana. So I'm going to turn that over. We're focused on the vaping, but we do talk about nicotine and the use of these devices, and that we know as a gateway drug. I mean, that is, I know Alexandra said that isn't used as much anymore, but we do in our advocacy. Nicotine is a gateway drug. So many kids, it's true, using these devices are using THC. And so I'll let Alexandra, who has an expertise in that, answer.
Yeah, so I love this question. It's a great question, and I could go on and on about it. But I'll mention two main points. So one is, when we look at research around marijuana use specifically and marijuana vaping, what we see is that kids in states where the marijuana legalization has taken place, even for medical use or for adult recreational use, we do see, first of all, this shift in perception that, if it's legal, if adults can do it, then it's not that bad. So this shift in perception and this shift in their attitude has also shifted their perception when it comes to marijuana vaping. And that is really emerging research that is coming out right now. And the second piece that I'll talk about is, if marijuana legalization is happening, then we do know that there are stores opening, cannabis stores, and there are dispensaries also opening. So if there are youth in a state that live close to any type of a dispensary or marijuana shop that does sell vapes, we can see how that could potentially affect use. So yes, that question really goes hand in hand. I do believe that marijuana legalization and vaping do kind of go hand in hand.
I just want to quickly jump on to add to your point. One thing we haven't talked about is the lack of enforcement. Parents reach out to us across the country every single day, often, saying, I live in this town and there is this store, and I've heard this multiple times, I have called the police. They say they're too busy. This was pre-COVID, by the way. I have called the local news and they keep selling. And as you said, kids go over the border. Like we know in Massachusetts, where all of these products are supposed to be banned, all flavored tobacco products, we think that there may be a store in New Hampshire, for example, where kids are going and getting these products and bringing them back back in. And so, you know, what we say to parents is you should feel empowered. Report that store to your local health department. We put on our website, parentsagainstVaping.org, the link to FDA where you can report individual stores. The problem is that FDA has not prioritized enforcement, and no one's prioritizing enforcement. And so on the local level, we encourage local groups, you know, for example, in towns in Massachusetts, in Livermore, California, where we're in a huge granular fight for the state of California, which is potentially, we're pushing for in the next 2 months, California, the entire state, we got through the Senate, trying to get through the Assembly to ban these products. But parents need to take, if they feel it's important to them, an active role in policing these vape shops themselves and reporting them, and then holding their elected officials accountable if no one does anything about it.
Thank you. I just want to let the audience know that we've decided to go over by 10 minutes to get more audience questions. So we won't get everybody, but we hope that you can plan for an additional 10 minutes, and then we will have a very brief wrap up. So Daniel, back.
Sure thing. So we have a question here about the regional element of prevention efforts. So how are prevention efforts modified based on region in the United States? For example, in some areas, you know, too much advocacy can be seen as interference in our lives. You know, if there's more of a libertarian streak. How do you modify that based on region and also in rural versus urban environments?
I guess that's a question for me, and I fear the very brief ending was also directed at me, so I apologize for speaking if I'm talking too much. So I will be brief. That's an interesting question. You know, we're both following the parents that come to us because we're a grassroots group. So, for example, if there are people in a state where there is no pending bill that we could join, you know, in supporting, then we focus on education, and we focus on building what we call our pods, which are our small membership groups, which is a bad pun intended on the jewel pods. So where there are places, you know, deep in tobacco country where they may not be ready for you know, pushing for one of these bans, or the local tobacco regulators and educators say, you know, this is not the right time, or this is not the right bill, there are too many exemptions. We focus on going in and educating if people are coming to us. And then places like Massachusetts, where we had local, you know, a local mom who was involved there with the coalition in Massachusetts, or in California. You know, California is a state that is ripe for a national, a statewide ban. And, you know, we spent all of yesterday focusing on one assembly member and getting phone calls from moms just in his district. It was that granular. So we do follow the coalitions, and the coalitions are following, again, the climate for this kind of thing. So I guess that's my best answer to that.
I have a question here about data. You mentioned the National Tobacco Survey. The question is, if the questions to teenagers when they're asked about vaping nicotine are asked, is it possible they'll be underreporting because many teenagers don't realize that there is nicotine in products such as Juul?
So I'm going to answer quickly and then turn it to Alexandra. That's a great question. And in fact, when Juul first came on the market, there was a lag because the surveyors were going into the field and asking kids, do you use ENDS products, electronic nicotine delivery systems? So kids were like, no, I don't even know what that is. The following year, when they were asked, do you Juul? Well, you have to ask the right questions. You know, that's the issue, right? Is that two things. One, our feeling is that the federal government has to come up with alternative and interim data collection. You can't wait a year. It's moving so quickly. And if you're not using the correct lingo, you're going to get old data. If the surveyors who were only briefly in the field, they're in from March to May. So of course, because of COVID, those surveyors, you know, who were working with schools and kids, you know, they weren't getting access. They got a very small sample. If they weren't asking kids, do you use Puff Bar? The new Juul, the disposable. Do you use Stig? Are you using disposables? If they say, do you use disposables? they're not going to get the right numbers. So that's the secular, that's the translation of what I think Alexandra may want to add on to as a researcher.
Yeah, no, definitely, Meredith. You really covered a great point, and also what researchers struggle with. We want to research and better understand vaping, but you really need to identify with what students consider vaping. Is it am I juuling? Am I using puff bar? Am I using this? Am I using that? So what we see really happening with research is that we're trying to A and B, but the kids are already at XYZ and they're talking about other things. And that's also, a call to just researchers and whoever is constructing survey instruments, that they need to be very, very careful to include the up-to-date lingo and really be ready to incorporate whatever is happening currently.
We have a question here about what efforts have been made to integrate advocacy and education efforts about the detrimental effects of vaping and e-cigarettes on adolescent health into existing school-based substance abuse programs such as DARE. Have these efforts been successful, and if not, why not?
I will just say, I mentioned that we just launched our volunteer toolkit for parents, in 2 different languages, so that parents can go to their schools and say, there is no, and I brought this up when we were asked to speak at a federal meeting overseen by the Surgeon General last September, the Interagency Policy Conference, and they asked us to speak, and they asked a teen who had been to rehab because of his nicotine addiction that was so severe, and one of the frustrations is, why isn't, if this is such a pervasive problem, the Department of Education, there should be, there is not, and we would like to see mandatory, or not even mandatory, but just really resource heavy education. The FDA does have resources for schools. I think it depends also on the city Department of Education, the state Department of Education. So there you could be in the city of Chicago, where we're also involved, in pushing for a city council ban on flavored e-cigarettes. And you could be in a school in Chicago where you have a teacher who has accessed really important resources from some of our public health partners. And there are a couple of great curricula out there. Both partners of ours, the Stanford Anti-Tobacco Prevention Toolkit out of Stanford Medical School, Catch My Breath Foundation out of the University of Texas, but they're very few. And I think because it's all so new, ultimately we would like to see that all schools be required to present this education. You might get it in a school in Chicago, and just half an hour outside, the teachers say, oh, we talk about it, but we don't really have anything to tell the kids because that person or that educator just has chosen not to, or really doesn't have the right resources. It's that granular, again, even on the education level.
I think one point I'll also just add on, which is, it diverts a little bit from the question, but I think it's really, really important to mention is also, when we talk about education, when we talk about educating teachers and parents and, schools and teens in school, it goes back to what Meredith just mentioned. What schools have access to this information? Which parents have access to this material? And I think that really opens up to more of a kind of a social justice issue, because we talk about you can really think about what districts or what schools or who really has access to this information.
By the way, I'll just say this was not the case in our school, but at that time, and Jewel has since abandoned it, we discovered that there were school districts both in Massachusetts and in California. They were school districts that did not have a lot of funding, and Jewel at that time, again, this all came out in Congress and was testified to publicly, that they were offering grants, I think of up to $10,000 to schools that did not have a lot of resources, saying, we will give you $10,000 if you are willing to use our curriculum, which, by the way, also came out in Congress. Some of those, some of the proprietary information without credit had been taken from the Stanford Medical School researcher, Bonnie Halpern-Felsher, the editor of that toolkit. So that predatory behavior, in that case, that they've abandoned that, but that's just sort of the tip of the iceberg of the social justice issue. So thank you for bringing that up.
Okay.
So we have
Thank you.
time for, oh, sorry.
Oh, do we have time for one more? Okay, the
Yeah,
last
sorry.
question.
Last
Okay.
participant question here. This speaking about schools actually comes from a school board member. So this individual says, as a school board member in the 4th largest school district in the nation, I realize that education is the key to everything. What suggestions do you have for specific policies that can be employed in places like bathrooms and other off-school properties where perhaps vaping can take place?
So that's a really important topic, and I'll say very quickly that one of the things that we do with some of the groups that we work with and we reach out to in Washington are things like, these national school superintendent groups to share our resources and give them information they can share with their parents, because as the school board member knows, this is a raging problem for teachers, for schools. They're spending so much time and energy trying to control this problem. They don't even have time to teach. So there's one device, patented device called the FlySense, created by Soter Technologies, that a lot of schools that afford it have been able to buy, that can sense in a school bathroom if someone has vaped. Obviously they don't put cameras in the bathroom, but if the sensor goes off, schools can see who's come out of the bathroom. It's a very big brother is watching. So that's, and you can, if you want more information about that, you can let us know. And then there's also a move among schools for alternatives to suspension. A lot of the pro-vapers say, we're just terrible parents. We're not setting rules. And our response is, if I am a terrible parent, it's not because of this issue. Everyone tries their best, but it's that we have to remember these were kids who were pretty much seduced through flavors and social media marketing into the use of these products. And we're talking not in every case, but in many cases about addiction. And so alternatives to suspension is coming up with, and there's a lot of, I can provide more information about that. Someone can reach out to us on our website, parentsagainstVaping.org, but there is a move. Instead of the one strike, you're out of school, you're off the team. If you talk about it as addiction and how do you work with kids to educate them or provide support and resources if they're addicted to nicotine and other products because of this, that's the way to approach it. Alexandra, do you have a thought about that?
You are definitely the expert when it comes to the prevention piece. But the only thing I guess that I would say is, as a researcher, history is kind of our best friend. So I would really look into, what prevention policies were implemented to work around alcohol use and tobacco use around child use. So we do learn from the past, and since the U.S. has been really, really successful with lowering the rates of tobacco use, combustible cigarettes, and alcohol use, we can really also learn a lot from previous policies in the past.
Great. Well, our time has come to an end. What a great discussion. I want to thank you both, but before the final thank yous, I'd like to end with a wrap up by asking each of you to give one sentence. If you want this audience to walk away with one thing to remember, what is the one sentence? I went from one phrase to one sentence, but no more than one sentence because we are out of time. So Alexandra, would you like to kick that off?
Sure. I guess I would just say that youth are our future and we have a responsibility to protect them. And also to researchers that we need to conduct better research. So, yes.
Thank you. And turning to the parent advocate, also known as an mom activist.
A momvacate. So I'm going to add, my second line is what she said, because I absolutely agree that's really important. And what I would say, coming from the parent perspective, is parents' voices really matter. And every small action a parent takes, whether it's a school board member going to the school and saying, what are we doing to educate our kids, or writing a letter to the editor, or signing a letter writing campaign to FDA, we have to make our voices heard to protect our kids. The government is failing us. They're not moving fast enough, and we've got to join in the chorus of wonderful researchers and public policy experts to make sure that we protect our kids. We don't want another generation of nicotine addicts.
Thank you. With that, I really would like to thank our speakers, both of whom have been fabulous. I think we've proved that there is a very useful conversation and mingling to join the researcher with the activist and together advance policy solutions. So thank you both. I'd like to thank the audience in particular, the alums, parents, and members of the and friends of the Brandeis National Committee. And I also would like to give a shout out to Brandeis's Office of Institutional Advancement, and particularly Allison Sakin, who has been the force behind this whole effort. So thank you all very much, and thank you for getting the word out that we are really facing another crisis in the U.S. with our youth, and it is the vaping crisis. And you've made great arguments from both the researcher perspective and the activist perspective. So thank you for that.
Thank you.
And thank you, Daniel, for doing a fabulous job of moderating the questions.
Well, thank you, Connie. Thank you, Connie, again, and thank you to all of you for joining us today, and thank you to our speakers, Alexandra and Meredith. It was a wonderful, fascinating discussion, and we're so delighted to see so many of our Brandeis community members coming together to continue this lifelong learning experience. We look forward to welcoming you to future events, virtual events throughout the summer. We have a whole listing of all of our upcoming events on our website at alumni.brandeis.edu/events, and be sure also to follow Brandeis U alumni on social media to be attuned to all of our upcoming events. So thank you again so much.